Hello and welcome to my channel. Today we are going to discuss 50 most important one-liners in ophthalmology. So let's start. What is the most common cause of visual loss in central retinal vein occlusion? It is macular edema. 90-day glaucoma is also called neovascular glaucoma. The most common cause of central retinal artery occlusion is HOLLENHORST plaque. Retinal ischemia is reversible within 90 minutes. Most common vascular disease of retina is diabetic retinopathy. Commonest cause of intraocular calcification is retinoblastoma. Most common intracranial tumor in retinoblastoma is PINEALOBLASTOMA. Most common secondary tumor in retinoblastoma is osteosarcoma. ERG waveform flattening is seen in retinitis pigmentosa. Most common cause of optic neuritis is multiple sclerosis. HOLLENHORST phenomena is seen in optic neuritis. Most common cause of papilledema, intracranial space occupying lesion. Altitude hemianopia is seen in AION. Foster Kennedy syndrome include unilateral optic atrophy and contralateral disc edema. Most common cause of monocular diplopia is cataract. Most common cause of binocular diplopia is concomitant squint. Diagnosis of TROPIA is by HIRSCHBERG test. The first ocular muscle to be paralyzed in myasthenia gravis is levator palpebrae superioris. Most common congenital cataract causing visual loss is zonular cataract. Polychromatic luster and breadcrumb appearance are seen in complicated cataract. Least incidence of secondary cataract is with hydropic acrylic IOL. The most common cause of early onset ophthalmitis after cataract surgery is by staph epidermis. Vox triad includes glaucom flunk, iris atrophy, peripheral anterior synechiae. The colored halos of cataract and glaucoma can be distinguished by Finjam's test. The first muscle to be restricted in thyroid eye disease is inferior rectus. The most common tumor of eye in HIV patients is Kaposi sarcoma. The most common primary orbital tumor of adult is cavernous hemangioma. The most common primary ocular tumor of adults is malignant melanoma. Raccoon sign is seen in neuroblastoma. The most common wall of orbit to fracture in blowout fracture is inferior wall. The most common site of lodgement of foreign body is palpable conjunctiva. Most common potentially blinding complication in HIV is progressive outer retinal necrosis. The most common ocular infection in HIV is cytomegalovirus retinitis. Anti-glaucoma drug of choice in children is topical carbonic anhydrase inhibitor. Shield cataract is seen in atopic dermatitis. Christmas tree cataract is seen in myotonic dystrophy. Congenital rubella syndrome includes nuclear cataract, glaucoma, salt and pepper retinopathy. Cranial nerve third palsy with pupils paired is seen in diabetic and hypertensive patients. Maximum diplopia in fourth nerve palsy is seen includes downward and inward gaze. Most common cause of sixth nerve palsy in children is pontine glioma. The reduced passive movement in forced duction test is seen in restricted squint. Lesion in optokinetic nystagmus is seen in Parietal lobe lesions. Most common visual defect in papilledema is enlargement of blind spot. 8.5 syndrome includes lesion at medial longitudinal fasciculus, lesion at parapontine reticular formation, plus the seventh nerve palsy of the same side. Huntington's pupil is seen in intracranial hemorrhage. Marcus-Gunn pupil is tested by swimming torch light test. Most common visual defect in retrobulbar neuritis is central scotoma. Rush disease is type 2 ROP. The most common cause of acquired Horner's syndrome or oculosympathetic paralysis is Pancoast tumor. So that's all guys. If you liked my channel, please subscribe to it.